Prolactinoma is a type of noncancerous or benign tumor that develops in the pituitary gland, which is a small organ located at the base of the brain. This pea-sized gland is often called the master gland because it produces hormones that control many of the body's essential functions, including growth, metabolism, and reproduction. One of the hormones produced by the pituitary gland is prolactin. Prolactin is best known for its role in stimulating the mammary glands to produce milk following childbirth. In men, prolactin is also present in much smaller amounts, and its function is less well understood, but it does play a role in regulating the immune system and the reproductive system. Prolactinoma occurs when a benign tumor, called an adenoma, forms on the pituitary gland. What makes these tumors unique is that they're composed of cells that produce prolactin. So, as the tumor grows, it pumps out more and more prolactin, leading to abnormally high levels of this hormone in the blood. It's important to know here that these tumors are almost always benign, meaning they're not cancerous and don't spread to other parts of the body. There are two main types of prolactinomas based on their size. Microprolactinomas are small tumors that measure less than 10 millimeters in diameter. These are more common and are usually diagnosed earlier because they tend to cause noticeable symptoms. Macroprolactinomas, on the other hand, are larger tumors, measuring more than 10 millimeters in diameter. These are less common, but can cause more severe symptoms due to their size and potential to press on surrounding structures in the brain. Prolactinoma is the most common type of pituitary tumor, accounting for about 40% of all pituitary adenomas. It can occur in both men and women, but they're more common in women, especially those between 20 and 50 years old. In fact, prolactinomas are about 4 times more common in women than in men. Causes of prolactinoma. The exact causes of prolactinomas aren't fully understood, but researchers have identified several factors that might play a role. In most cases, prolactinomas occur sporadically, meaning they develop by chance without any clear cause. However, in a small number of cases, they can be associated with certain genetic conditions. One genetic condition linked to prolactinomas is multiple endocrine neoplasia type 1. This is a rare inherited disorder that causes tumors in the endocrine glands, including the pituitary gland, pancreas, and parathyroid gland. There's also some evidence that prolonged use of certain medications, particularly those that block dopamine, might increase the risk of developing a prolactinoma. These medications include some antipsychotics and certain drugs used to treat nausea and vomiting. Symptoms of prolactinoma. The symptoms of a prolactinoma can vary widely depending on the size of the tumor and the amount of prolactin it produces. Some people with small prolactinomas might not have any noticeable symptoms at all. However, for many people, the first signs of a prolactinoma are related to the excess prolactin in their system. In women, one of the most common symptoms is irregular or absent menstrual periods. This happens because high prolactin levels can interfere with the normal production of estrogen and progesterone, which are hormones that regulate the menstrual cycle. Women might also experience galactorrhea, which is the production and discharge of breast milk when not pregnant or breastfeeding. This can feel strange and even alarming, especially if you're not expecting it. Another common symptom in women is infertility. The hormonal imbalances caused by a prolactinoma can make it difficult to conceive. Some women might also experience a decreased sex drive and vaginal dryness, which can affect their relationships and quality of life. In men, the symptoms can be a bit different. High prolactin levels can lead to a decrease in testosterone production, which can cause a range of symptoms. These might include erectile dysfunction, decreased sex drive, infertility, and in some cases, enlarged breasts, a condition called gynecomastia. Men might also experience a loss of body hair or a decrease in muscle mass. Both men and women with prolactinomas might experience headaches, especially if the tumor is large enough to press on surrounding brain structures. Some people describe these headaches as a dull, constant ache, while others might experience more severe, throbbing pain. Vision problems can also occur with larger prolactinomas. The pituitary gland sits very close to the optic nerves, which carry visual information from the eyes to the brain. If a prolactinoma grows large enough, it can press on these nerves, leading to vision changes. This might include blurred vision, loss of peripheral vision, or even blind spots in the visual field. It's worth noting that many of these symptoms can come on gradually, and some people might attribute them to stress, aging, or other factors. This is why it's important to pay attention to changes in your body and discuss any concerns with a doctor. Before we continue, if you have been finding the video helpful so far, hit the like button and don't forget to subscribe and hit the bell icon so you don't miss more videos like this. Diagnosis of prolactinoma. Diagnosing a prolactinoma typically involves a combination of blood tests, imaging studies, and a thorough medical history. The process usually starts when a person reports symptoms to their doctor, or sometimes when routine blood work shows elevated prolactin levels. The first step in diagnosis is usually a blood test to measure prolactin levels. Normal prolactin levels can vary, but they're typically below 20 nanograms per milliliter for men and below 25 nanograms per milliliter for non-pregnant women. Levels above 200 nanograms per milliliter are usually indicative of a prolactinoma, although other conditions can also cause elevated prolactin levels. If prolactin levels are high, doctors will often repeat the test to confirm the results. They might also test for other hormones produced by the pituitary gland, as prolactinomas can sometimes affect the production of these hormones as well. The next step is usually imaging of the pituitary gland. The preferred method for this is magnetic resonance imaging, MRI. An MRI can provide detailed images of the pituitary gland and surrounding structures, allowing doctors to see if there's a tumor present and, if so, how large it is. In some cases, if an MRI isn't available or suitable, a computed tomography scan might be used instead. In addition to these tests, doctors will typically perform a thorough eye exam, especially if they suspect a large tumor. This exam checks for any changes in vision or visual fields that might be caused by the tumor pressing on the optic nerves. It's important to note that high prolactin levels don't always mean you have a prolactinoma. Other conditions, such as hypothyroidism, kidney disease, and certain medications, can also cause elevated prolactin levels. That's why a comprehensive evaluation is crucial for an accurate diagnosis. Treatment for prolactinoma. The good news here is that prolactinomas are often very responsive to treatment, and many people are able to achieve a full recovery or at least significant improvement in their symptoms. The main goals of treatment are to lower prolactin levels, shrink the tumor, and relieve symptoms. For most people with prolactinomas, the first-line treatment is medication. The most commonly used drugs are dopamine agonists, which work by mimicking the action of dopamine in the brain. Remember, dopamine normally inhibits prolactin production, so these medications essentially trick the body into producing less prolactin. The two main dopamine agonists used for prolactinomas are bromocriptine and cabergoline. These medications are often highly effective. They can lower prolactin levels, shrink the tumor, and relieve symptoms in most people with prolactinomas. Many people see improvement within a few weeks of starting treatment, although it can sometimes take several months to see the full effects. However, like all medications, dopamine agonists can have side effects. These might include nausea, dizziness, and headaches, especially when first starting the medication. These side effects often improve over time as the body adjusts to the medication. For people who can't take dopamine agonists or who don't respond well to them, there are other treatment options. Surgery to remove the tumor is sometimes necessary, especially for large tumors or those causing significant vision problems. This surgery is typically done through the nose and sinuses, a technique called transsphenoidal surgery. It's a delicate procedure that requires a skilled and experienced surgeon. In rare cases, radiation therapy might be used, usually for tumors that don't respond to medication and can't be fully removed with surgery. Radiation can be effective at controlling tumor growth and lowering prolactin levels, but it works more slowly than other treatments and can have long-term side effects. For very small prolactinomas that aren't causing symptoms, doctors might recommend a watch and wait approach. This involves regular monitoring with blood tests and MRI scans to check if the tumor is growing or if prolactin levels are rising. It's important to note that treatment for prolactinomas is often long-term. Many people need to continue taking medication for several years, and some might need lifelong treatment. However, in some cases, especially with smaller tumors, Treatment can eventually be stopped if prolactin levels remain normal and the tumor doesn't regrow. Now, we want to hear from you. Do you or someone you know have a prolactinoma? What symptoms did you have at first? Share with us your experiences and opinions in the comments below. We love to hear them. Thanks for watching.